Also, as you also know, we have lost 2 healthcare workers to COVID-19. This is like losing a soldier in the middle of a battle. Therefore, we need to keep our medical personnel as safe as possible. Besides providing them with protective gear, we have also continually addressed their welfare needs. We note some mamas among some of the workers, and we would like to address those mamas as well. In this regard, it is important to note that service delivery remains a county government function and urge all county governments to listen to any complaints, murmurs, or concerns among our healthcare workers with a view of addressing them in the soonest possible time. As a ministry, we stand ready to extend our support as may be necessary to ensure that our people are served across the country. Further, we recognize the need to hire more health workers and personnel in this field, and I'm glad to hear, Madam Chair, that that is indeed what you are preparing to do in this institution. We have increased the funding to county governments to do exactly that, and it's our hope and expectation that where there are shortfalls, they will be addressed as soon as possible. It might be recalled that when we confirmed the first case, many other countries around the world were doing the same. Some were already in the middle of their war situation, and the global demand for PPEs was huge. We got into the market at a time when this demand was extremely high. But because we had an emergency, we had to contend with the situation as it was. Price is largely controlled by demand and supply schedules. But while we worked on this situation, we started addressing our local capacity for the production of PPEs to make sure that we were not subjected to prices that were not cost-effective to our service delivery. Consequently, we challenged our local manufacturers to develop PPEs, and I'm glad to note that they stepped up to the challenge, and we are now producing our own local and even exporting some. Aware of the need to allow for competition in the supply of these essential commodities, the ministry sought a waiver for the counties to acquire PPEs from different suppliers and not just from KEMSA. This way, we expected, and it still remains our expectation, that counties would get best value for their money and for public money. We continue to urge prudence in the acquisition of these PPEs and indeed all health commodities to ensure that we deliver value to our people. And I wanted to make those remarks because obviously there has been press reports about the prices that were there before for PPEs, the prices that were there for face masks, but I would like to say that anybody doing a little research will find that that indeed was the situation across the world at that time.